extending our freedom and our liberty to be here today. So let's have a moment of silence, please, for our troops. And then what we're going to do after that, we're going to say the Pledge of Allegiance. And let's say the Pledge of Allegiance, please. Stand up, please. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. I want to first say thank you to Ms Kaptur for, I got an email about a week ago, and Marcy was going to do two things. She had a little thing last night where she had an appreciation for her service, and then she had this thing scheduled for today where she was going to allow her constituency to come in and ask her questions regarding the health care bill. I know everyone in this group has been following this health care bill for probably months, if not a year, and the bill is no longer a bill. The bill is now the law of the land. And as such, I'm sure I had questions and you had questions, and I want to thank Marcy for setting up this facility to give us the forum to come and meet with her and ask those questions. Now the bad news. 9 o'clock this morning, Marcy Kaptur canceled this room, and at 9:15 this morning, when I found out about this, I decided that I would take it upon myself to go ahead and reserve this room and make sure that at least we had the forum and the venue to go ahead and ask Marcy these questions anyway, even though she wasn't able to be here today. So what I've done is I've placed a sign here. I'm going to bring a seat and chair over here, and what I'm going to ask you to do when you ask your question, I'm going to ask you to direct it at Marcy's seat. Seeing she's not able to be here this afternoon, what we're going to do is we're videotaping the proceedings here, and we're going to forward a copy of that tape to Marcy, and then perhaps at some point in the future she can get back with us and address these issues. What I've done is I've prepared a list of questions that I was going to ask her. Unfortunately, there's about 20 questions on that list, and she's not here for me to ask. And just from talking to people out here, I understand that a lot of you had exactly the same questions I had. So what I'm going to do is I'm going to call off a number. When your number comes up, what I want you to do is I want you to ask those questions. I'd like you to come up to the podium, and again, I'd like you to address Ms Kaptur and go ahead and ask her your question. If you have any comments, what I do ask that you do is I do ask you to keep. I'm not interested in a lot of political rhetoric. What I'm interested in is I want questions that she can answer. And by God, from talking to people and hearing people, I think we have a whole bunch of questions. We're going to start. Here just momentarily. We're going to continue probably until everyone is finished asking their questions. I anticipate probably 45 minutes to an hour. If you guys want to run a little bit longer and just shoot the breeze, that's fine. I have this room until 8 o'clock tonight, so we can sit here and you can't smoke or drink in here, but we can sit around and shoot the breeze and just do whatever you want to do. So what I'd like to do is I had a sheet with questions on it, and I'd like to ask the people. I'm dyslexic, so I already promised a couple people that I would allow them to go ahead and ask their question first. Number 9, when you come up here, what I ask you to do is, if you would please, if you're comfortable doing this, give your name and your district or where you live, just like you would in like a city council meeting, and then address your question to Marcy. Please. Yes, I'd like you to come up here and do this.
Ms Kaptur, my name is Rebecca Vaughn. I am one of your constituents, and I have a question. The language
My name is Harold Grove. I'm from Savannah, Ohio. I live in the 9th Congressional District. Ms Kaptur, there is language in the law that specifically says portions of this law cannot be brought up for debate or targeted for repeal forever. Although I personally believe that smacks of tyranny or far worse, and although it may not hold up in the United States Supreme Court, why could you possibly vote for such a language?
Thank you. Let's flip back to number uno. I told you I had dyslexic numbering system. Well, there you go.
Congresswoman Kaptur. My name is Marilyn Oliver, and I live in the 9th District. The bill that just became law, the House of Representatives spent months altering the version of the health care bill reform and passed their version in the fall of 2009. The bill that was signed into law was the version of the Senate bill that was passed on Christmas Eve 2009. Normally, these two versions would have went into committee. They would have been combined to work out the differences. Then the combined version would have been returned to the floor where they would have been re-voted on by the House and the Senate. My question, why then did you throw out months of work that you and your staff put into the original House bill and vote to accept the Senate version? Why would you use the reconciliation process to pass the most significant piece of legislation in the history of the United States? Thank you.
Good.
In the 9th District, I have a question. It's concerning abortion. A presidential executive order does not take precedence over a law. If it did, this would render the legislative branch of the U.S. government an act. The law that you voted for clearly states that the government will reimburse for abortions. Can you explain why you voted for government-funded abortions? Thank you.
Thank you. You guys go for it. If you, yeah.
Okay, Ministers, I still have another question for you. It's concerning medical malpractice and tort reform. Medical malpractice lawsuits make up a significant portion of the costs in the health care insurance. I had a one-hour meeting with the legislative representative from Sherrod Brown's office on March 16th in the D.C. office. The representative indicated that Senator Brown fully supported the Senate version of the bill and was happy that it would lead to a single-payer system. My analysis of the bill leads me to the same conclusion, that within 15 years, we will be at a single payer, like Canada and Britain style health care. Were you aware of the single payer goal when you voted for this bill? And another question was, are you aware that the Prime Minister from Canada came here from Canada to go to Florida to have heart surgery, and he was asked why he did this. And he says, it's my heart